Thank you for this opportunity to present our results on anxiety and depression among women with pelvic floor disorders. We have no disclosures. Pelvic floor disorders, anxiety and depression are common conditions that have been shown to negatively affect quality of life. Our aim was to explore the prevalence and predictors of anxiety, depression among women with urinary incontinence, anal incontinence and double incontinence as compared to women who have no symptoms. The data in our cross-sectional study was from a large population-based health survey, the HUNT3, and was collected from June 2006 to October 2008. The prevalence of anxiety and depression was assessed using the Hospital Anxiety and Depression Scale, the HADS. Multivariable logistic regression analysis was applied in two separate models with the HADS subscales for anxiety and depression as the independent variables in these models. Data on pelvic floor disorders and HADS was available for 12,954 women. 60% reported no pelvic floor disorders, whereas 10% reported anal incontinence alone and 8% reported double incontinence. Mean age for the participating women was nearly 50 years. Mean BMI was nearly 27 and just over half were menopausal. Overall, the prevalence of anxiety and depression increased with increasing severity of pelvic floor disorders, and symptoms of anxiety was reported more often than depression for all groups. 13% of continent women reported anxiety scores over 8 points, compared to 24% among those with anal incontinence alone and 28% of women reporting double incontinence. Just under 5% reported moderate to severe depression among women with double incontinence, compared to just over 1% among those who did not have any pelvic floor symptoms. Compared to women with university or college education, women with primary or secondary level education were twice as likely to report anxiety. Women with urinary incontinence were 50% more likely to report symptoms of anxiety compared to continent women, whereas the odds of women with double incontinence reporting anxiety was 2.5. Similar trends were seen in the model with depression as the independent variable. Women with lower education and more severe symptoms were more likely to report depression. Our results show that mild to moderate symptoms of anxiety and depression is common among women with pelvic floor disorders. The prevalence was higher among those reporting coexisting urinary and anal incontinence compared to continent women and those reporting only one pelvic floor disorder. Symptoms of anxiety and depression were associated with pelvic floor disorder severity and educational level. To conclude, when planning treatment and follow-up of patients with pelvic floor disorders, healthcare professionals need to be aware that women with more severe pelvic floor disorders have increased risk of anxiety and depression. Thank you.